The other body spent yesterday and well into the night to vote out bills that would repeal and reform Obamacare. I don't know exactly what's going to happen in the other body on that issue, but I would like to add some thoughts on the issue of repeal and replace. Obamacare has been a case of overpromise and also under-delivery. People were told that their premiums would go down by $2,500. They've actually gone up probably on an average of $3,500. And that they were also promised that if they liked their doctor, that they'd be able to keep that doctor. Millions of people have had to change doctors. And then they were told that they could keep their health care plan. And millions of people have had to change their health care plan. So, in fact, Obamacare has been a case of overpromise and under-delivery. The reality is much different. Obamacare is hurting more people than it is helping. I've heard from many Iowans about the tremendous premium increases, and most importantly, all about high deductibles and high copays that make Obamacare not worth its consideration. One farmer said his health insurance premium went from $20,000 to $30,000 in 1 year. Another family said that their Obamacare premium increased 144% over 3 years. The 2017 premium for 3 people was over $24,000. And families that did manage to purchase Obamacare insurance found that they could no longer afford to use it because of sky-high deductibles and copays. Another Iowan said that his policy for his family of 3 increased from $15,000 a year to $23,000 in 1 year. But more importantly, the value of that policy being less because the deductible for that plan is nearly $6,000. It's quite obvious, as you think of these situations, very few people can afford some of the prices or afford the deductibles that we hear about. So I think it's very clear summation to say that Obamacare is not working. According to Avalar, 1/3 of the country will have only one insurance carrier offering Obamacare plans next year. Since that analysis by Avalar, another insurance company has pulled out of Obamacare, leaving some parts of the country without any insurance companies whatsoever for the folks to choose from. So many insurance companies have dropped out of Obamacare that there are places in the country where people have a subsidy but no insurance plans to buy. That is like having a bus ticket and there's no bus to take you anywhere. Even those who were strong supporters of a health care law, like as an example, the Democratic governor of Minnesota, have said, or he said, and I'll quote, the ACA, quote, is no longer affordable to many Americans, end of quote. The problem with Obamacare is it did nothing to address the underlying causes of the high cost of health care. That is, what it costs for a hospital or doctor to purchase and maintain medical equipment, purchase medicines, carry malpractice insurance, and things like that. Rather than address the actual cost of care, President Obama chose to bypass real health care reform for an unsustainable entitlement and, of course, bureaucratic mandates which have priced people out of the health care insurance market rather than provide them with affordable and quality coverage. It's time then, as the House was working over the night, to deliver more accessible, more affordable health care to even more Americans. Obamacare has failed on both of these points, with 29 million people still do not have health insurance. It is time to reduce the role of the federal government in the health care system, because I think that expanded role is one of the very basic problems that we have with Obamacare. It's time to spend less and get better quality care. So I urge my colleagues on the other side of the aisle to work across the aisle in a bipartisan way. They know that the Affordable Care Act is not serving the purposes that it was intended to serve and is falling apart, and in a short period of time, it may collapse. So I think the other side is trying to distract attention from the Affordable Care Act collapse, and they're doing it by using the usual scare tactics. Used to be those scare tactics were applied just to Medicare improvements, but now they're applied across the board of health care delivery in America. It's time for the other party to step up instead of doubling down, because it was their plan passed in March of 2010 that put us in this spiral we're in. It's time for statesmanship, not gamesmanship. It's time for the people that are responsible for Obamacare to stop defending that Unaffordable Care Act and deliver Americans what was promised. I look forward to working with all of my colleagues and, of course, our new president to deliver affordable health care to more Americans.